Hello, everyone, and welcome to another episode of our CCC Spotlight series. For May VHL Awareness Month, we're interviewing 4 separate medical professionals from the Comprehensive Clinical Care Center at Huntsman Cancer Institute in Salt Lake City, Utah. Huntsman will be hosting this year's VHLA Annual Family Weekend in October. Today, I'm excited to welcome Huntsman CCC Point of Contact and Genetic Counselor, Samantha Greenberg. Samantha received dual master's degrees from the University of Michigan in genetic counseling and public health after teaching 7th grade science in Tulsa, Oklahoma. Samantha oversees the VHL Clinical Care Center, Paraganglioma Clinic, and high-risk prostate clinic at Huntsman, along with a multidisciplinary team. Her research and interests center around VHL, prostate cancer genetics, paragangliomas, and education. In addition to her clinical role, Samantha also serves as a faculty member with the University of Utah Genetic Counseling Program. Samantha, thank you for joining us today.
Of course, happy to be here.
So let's jump right into it. Samantha, when and why did you first decide to become a genetic counselor?
Yeah, that's a great question. So growing up, I really liked teaching and I really liked medical and thought about, becoming a doctor. And when I started at the University of Michigan for undergrad, there was an undergraduate research program. And one of the guest speakers that came was a genetic counselor. And she talked about how, genetic counseling is kind of the perfect blend of medicine and education and working with people. And there's a lot of kind of, ethical and psychosocial and things that kind of go on in the realm of genetic counseling. And so to me, genetic counseling felt like that perfect mix of medicine and education and really getting to work with people on a regular basis.
That's great. What got you interested in specializing in inherited diseases like VHL?
Yeah, so when you train for genetic counseling, you can kind of think about a number of different specialties. There are prenatal genetic counselors and pediatric genetic counselors. And one of the things that I really liked about cancer genetic counseling and oncology-based genetic counseling is that there's such a preventative aspect of it, that the reason that you do this, process of genetic testing or, high-risk inherited disease identification is the opportunity to be able to prevent things and to find them early. And this was really kind of what drew me to cancer. As far as VHL and other conditions, I'm someone who really enjoys working with children and adults and kind of having a variety of patient interactions. And many of our patients in the VHL realm and in some of the other conditions, we see them as young as 1 year old, and we see them as they kind of move throughout the lifespan. And so the opportunity to work with patients across a long period of time was really appealing to me. And I think there's an aspect of the the multi-organ aspect of VHL and other conditions. VHL isn't something that just impacts one system, and the systems that it impacts in different ways. And that means that there's an opportunity for research and clinical care and multidisciplinary collaboration that you really get to experience with VHL clinical care.
Talking about the multidisciplinary approach that you just talked about, how important is coordinated care for people with VHL?
Yeah. So VHL coordinated care in general is supremely important, and I think in VHL especially so. It can be really easy to, miss something or lose track, right? Our VHL patients see so many doctors in a year often. And so having a system where they're able to see and have somebody that's monitoring all of that care and helping them navigate. Sometimes patients come in and one doctor recommends coming back in 4 months and one recommends coming back in 6 months. And coordinated care allows them to meet in the middle and say, hey, does 5 months work for both of us? Or can we align that so our patients can have a similar experience? Out here in Utah, a lot of our patients come from all over. So a good chunk are from Utah, but they come from Idaho and Montana and Wyoming, Nevada, Colorado, Arizona, different parts of those states. And it's really important that when they make that commitment to drive up, that we're able to provide all of that care in one place. And so I think coordinated care is especially important when the geography is a little bit more spread apart, but it's really important in general because it gives people an opportunity to kind of do as much as they can at once, which means that we're more likely to make sure that our patients get all of the care that they need.
I know Huntsman is widely considered to be a top hospital, and I wonder if it's exactly because of this collaborative approach.
Yeah, I think that at Huntsman, becoming a VHL care center was really natural, right? We were already doing some of it, and so formalizing it and adding just a few more processes allowed us to really streamline our care. But outside of VHL, you can see that in a lot of different places. We have clinics for patients who need other kinds of multi-organ care. So women who may be looking at risk-reducing surgeries, they can have multiple consultations in a day. And so I would agree with you. I think that one of the things I love about being at Huntsman is that ability to have that coordinated care, across many, many disciplines.
What has been the most memorable experience for you as a genetic counselor, and maybe what some of the more challenging and rewarding aspects of your job are?
Yeah, that's a great question. I have to say that the most rewarding part is all of the work that we do with our patients. Through VHL and through other centers, being able to build maybe not lifelong, but really long, and connected relationships with these patients. We have a number of families here at the center that, we've watched them come from middle school to high school and progress on, or start in college and move on to, take on jobs. And so getting to kind of grow alongside them and be a part of their journey, even oftentimes if it's just from afar, I think is really rewarding. It can be challenging to adapt and navigate the world of VHL, but being able to work alongside these patients and alongside the providers, I think is just a really rewarding experience. I'd say some of the more challenging sides. Coordinated care isn't perfect all the time. Sometimes we have, clinics on different days, or we can't get things scheduled and things like that. And so for me, those are challenges I really enjoy. I think that having kind of an issue and being able to tackle it head on, and knowing that at the end of that, right, there's that patient that you have that connection with, or that you've built that rapport with, is really beneficial. I would say the other kind of aspect that has been really rewarding as a genetic counselor is the work that we've been able to do to be able to move the field forward. And I attribute all of that to our patient interactions as well, but many of our patients are enrolled in research. And research really allows us to kind of continue moving the field forward. It allows us to learn more about our VHL patients. It allows us to learn more about if screening works. Are we testing the right people? And so that combination of not only getting to work alongside those patients, but our patients kind of placing their medical information in our hands to do research with, and to move the field forward. We couldn't do it without our patients, but it makes it even more rewarding. And so the challenges feel really small in comparison.
It really is a relationship that both sides need each other. So it's really amazing to have a partner like you guys at Huntsman.
Yeah.
I wonder why is it so important for people with VHL to work with a genetic counselor?
Yeah, that's a great question. So I think one of the things about genetic counselors is that, especially kind of here and in this center, right, we serve as kind of that hub that's able to help navigate among the different specialties. And so the different specialties can talk with one another, but I think it can be challenging if one specialty is ordering across a number of conditions or a number of organs, right, and that organ may not be in their area of expertise. And in genetics, while the organ itself isn't our area of expertise, right, the condition is. And what kind of risks VHL comes with, right? So helping know, okay, while they're doing this abdominal scan, yes, we found something in the kidneys, but there's also something here we need to address. Our role is to really help say, hey, we work with this team here. And so really helping navigate that care though our clinic doesn't run, without our high-risk physicians, and we're really privileged. I know Dr. Sanchez was on yesterday. We have some other high-risk oncologists who also specialize in these conditions. And so that partnership in a high-risk genetics clinic allows us to see patients, identify what they need, and then help navigate those scans and that process after. So that's not to say that seeing a genetic counselor is the best or the only place to go, but I think at least for our setup, we kind of serve as that hub. I also think that nuanced questions arise, and a lot of the questions that I get from our patients are ones that either there's a specialist that they haven't worked with before, or they're just not quite who the right person is to ask. And so about half the time we're able to triage those questions. Those are things that from a genetic condition perspective, we have the answers for. And the other half of the time, we can reach across to whoever that right specialist is. And so I think that's one role that kind of we play in the genetic counseling realm here.
How do you think genetic counseling for people with VHL will change over the next 5 to 10 years?
Oh, that's a great question. I think that one of the things we've learned a lot about in the last while is, area for diagnoses of VHL. And we know that genetic testing for the VHL gene is really accurate, right? If people meet criteria, we're often to find a genetic change. But I know from working with people kind of across the country and across the world, there are exceptions to that rule, and people who very clearly look like they have VHL, but there isn't a change that can be found. And so I think really working within those realms, and I think helping facilitate those conversations, I don't know that much of that research will happen alone because VHL is rare and because we work with a lot of patients. But to do that kind of research and find new genetic changes, you really need a team. So I think that the world of genetic counseling and research in VHL is going to continue to adapt, kind of evolve and adapt in those multi-team collaborations. I also think that a lot of research has been done and is continuing to be done on the benefits of screening. But we know that screening and getting all of those scans can be a challenge. It's super important, and our role is to facilitate that as best we can. But we know that there are a lot of things that happen in life that can impact that. And so continuing to work alongside our patients, but also thinking about, is there a pattern? Are there things that we can do on a more structural level to make sure that our patients don't have any barriers to screening, I think is really important. And hopefully is, what's coming in the future.
It's obvious how much you care for the patients and families and what you do. So, but we also want to learn a little bit about you from as a person outside of the hospital. So I wonder if you could share with us any passions or hobbies you have for outside the hospital.
Yeah. So one of the best parts of moving to Utah, while I've loved everywhere I've lived, but the outdoors are abundant here. And so as someone who used to ski once a year, now I ski, 20 to 30 times a year. And that's really been kind of a great source of stress relief and hiking. As you mentioned, right, we're really excited to have everyone here this fall. Late October is kind of perfect hike season, and we have some incredible hikes just right behind Huntsman and where a lot of our families will be staying. So I think that's kind of what we normally do outside. I exercise a lot, and Utah has some really interesting group exercise classes and things like that haven't quite made it as more widespread. And so that's been really fun to kind of see them come and participate in those here in Salt Lake City as well. Outside of just spending time with friends and right now spending time with friends virtually.
And what's a fun fact about you that most people don't know?
Oh, this is a tough one. So this is going to be a little bit of a flashback. So depending on the age range, may or not be related. But when I was in middle school, I was on Fun Time Live, the Nickelodeon television show that used to air at different times over the course of the years. But even though I am well past my middle school days, it is still one of the pride and joy accomplishments of my life. But the bike that I won from it, was with me for over a decade. So, random fact.
Wow, I didn't realize that we were talking to a celebrity today.
Yeah. Very marginally and less so. The only other fun fact is just my absolute love of University of Michigan sports. But I think that most of my patients and many people who may be watching this may already be aware of that. So it's less, the Fun Time Live is less known.
That's great. If you could give patients with VHL one piece of advice, what would it be?
Yeah. I think that sometimes people with VHL live, maybe feel like they don't live near a care center, or that they're kind of, that it's hard to navigate. And my best piece of advice, is to really take a look at the VHL Alliance resources and to find, who may be closest. A lot of times we collaborate with providers who live quite far away to minimize the visits for our patients. And so really kind of continuing to pursue resources until you find what works for you. Some people choose to come, every year to be able to see us, and some kind of choose to use that collaboration across providers. And ultimately, everybody who cares for patients with VHL has a vested interest in them. And so really kind of continuing to pursue those resources, using you guys as a resource to find what you need, whether it's kind of caregiver support or, support from your team or from a care center near you. That would be my piece of advice. And to come this fall.
That's great advice.
We're excited.
Yes. We have one question from the audience. How many or what percentage of your patients that you see have VHL?
Yeah, that's a great question. So I see kind of patients with all types of risks for hereditary cancer. So patients could have family histories of breast cancer. They could have, personal histories of prostate or pancreatic or ovarian cancer. I don't know that I could say an exact percentage. We have about 40 VHL patients in our care that we work with in any given year. And so from a volume perspective, because VHL is not as common as breast cancer and things like that, it's going to be a smaller proportion. But our team, any patient with VHL who presents to our center is going to kind of come in through our care process. And so normally that's anywhere from 5 to 10 new patients a year, depending on the time frame.
Samantha, once again, I just want to thank you so much for taking the time to join us today, as well as everything you do for your patients and for the VHL community.
Of course. Thanks for having us.
Thank you. And for everybody watching at home, you will be able to meet Samantha live and in person at this year's VHLA Annual Family Weekend, hosted by Huntsman Cancer Institute in Salt Lake City, Utah, on October 23rd to the 25th. You can find more information about the weekend, including registration, at vhl.org/familyweekend. You can find more information about other great May VHL Awareness Month events at vhl.org/mayawareness. We hope you will join us for future events, including the annual Family Weekend. Until next time, stay safe.